This is a story about those with strength, helping those without. A story about those with a voice, working with those who must whisper.
Louder.
And this is a story about the mysterious bond between these dogs and these men. Near the shores of White Bear Lake, Minnesota, live two German shepherds, 7-year-old Susie and 4-year-old Thor. Both are working dogs, but their occupation is not what you might think. They work in the medical field as animal therapists. Twice a month, the canine therapy team, along with their owner and trainer, Carol Uhl, load up and head for the Struthers Parkinson Center of Methodist Hospital in Golden Valley, Minnesota. Here they work with people coping with Parkinson's, a debilitating disease that affects the part of the brain that controls movement. Al Chinnick works with Susie. His vocal cords no longer respond spontaneously.
Okay, you gotta breathe.
During therapy, he must give Susie commands loud enough and clear enough for her to understand.
Yes, now you can give her a treat.
Speech therapist Roberta Wares uses cue cards to prompt Al without inadvertently prompting Susie.
Al, the stronger your voice, the faster she'll come, okay?
Carol stands behind Al using hand signals to instruct Susie.
We've got an initial period where the dog has to get used to the person and the voice. So we do more repetition of maneuvers or behaviors so that the dog can acclimate and begin to associate, oh, this sound coming from this person really means sit, when that's not what she thinks she's hearing.
Susie works for treats, and Al often tries to give her an advance.
Oh, sneaking treats. This is not a bribery situation here.
But eventually, hard work pays off for both Al and Susie.
That a girl? Yes. Very nice. Tail wagging and everything.
Down.
Yes.
That's where we whisper. You got it.
Al's wife, Marilyn, has seen significant progress during the 4 months Al has worked with Susie.
When he first came here, he wasn't even talking. Now he's talking, and at least he's throwing toys and telling them to fetch and come and sit, and that's great. Super. It's really exciting for me.
But this kind of work demands a lot from Susie, and Carol soon realized that she could use some help. So when Susie delivered a litter of pups, one was picked to follow in her footsteps. It was Thor, who began training to be an animal therapist when he was just 3 days old. He got his first full-time job at age 2, when an injury prevented his mother from working for a time.
When we first started working with Thor, he had to learn some things on the job. We discovered purely by accident that some people related much more intensely to her than to him, or some to him and not to her. He has a higher energy level and will tolerate working longer. She's a little more reserved and careful about her movements, so we use her with people where she has to be very careful and very gentle.
I'm gonna help you get started. Gotta loosen up your arm, you're just so tight. Can you pat the dog?
He's better with people who want more activity.
Wonderful. Very nice.
Yep.
Thor has connected with Adrian, whose therapy goals include speech work as well as muscle strengthening. Parkinson's patients like Adrian become increasingly trapped inside their failing bodies. Roberta Wares explains how Susie and Thor help them escape that prison.
The animals bring them out. You can see it in their eyes. They will spontaneously reach for animals like they won't spontaneously reach for people. So they come out of themselves much more readily. As you saw today, Adrian decided to run the show, and that's exactly what we want him to do, is to decide what the dog is going to do, remember the words, and call it off spontaneously.
Roberta and Carol have witnessed the silent communication many times during the 2 years Susie and Thor have worked at Struthers.
One gentleman we worked with for a long time used to tell me I was working the dogs too hard. And somehow or other that dog knew that, because I'd ask her to do a maneuver and she'd run over next to Bob and sit down and look at him like, you aren't going to let him make me do that, are you? And he'd pat her on the head. So there's the human-animal bond is always working. Come here, little guy.
Susie and Thor don't just work with humans, but other dogs too. On weekends, they help Carol conduct workshops for people who drive cross-country for this specialized dog training.
Anyone's dog can learn to do this. That's not the hard part. The hard part is whether or not the dog decides they want to do it and they like it.
Carol explains control is key, both for the handler and the dog.
So, now, if I take this dog, come up there, pups, and I'm on a visit and I have to work my way around, don't sniff there. Uh-oh, we got trouble here. Now, did you see what she did instinctively? She put her hand in this dog's collar. Sniff. She had one hand on the hind end, one hand in the collar. She had control of her dog. Thor.
But even an experienced dog like Thor can feel job stress.
If your dog wants to jump up, like Thor did, now Thor does it when he's feeling a little insecure. If I reprimanded him and put him down, his insecurity would rise. So I simply say, it's okay, I'm here. I'm not going to baby him. I'm not going to hug him and pet him and kiss him. I am going to require, if he comes up though, Thor, no, pause, that he come up in a safe fashion, because you're going to use that on a visit.
The knowledge and training others receive from Susie and Thor mean that they too can someday help those in need. Kelly Johnson hopes that's the case for her retriever, Fancy.
It brings tears to your eyes to realize that the dog can do that and the people can't.
Ready to take a deep breath? Thor, come here. There are times where a client is totally frozen in the corner, not making any motion, and the dog will spontaneously come over and put their head on their lap as if having been called.
Can you shake? Oh, Bobby.
For these magnificent animals, this is not just a job, it is a calling.